Are we live, Jessica?
Yes.
All right. Shall I start?
Yes.
Okay. I'm Jane Malin. I'm the president of the board of NAMI Greater Houston. Welcome, everyone. Our attendees and candidates. And Jessica, can you show the poster for the forums? Vote for Mental Health Forum. 4 of them, and this is our first one. Let me tell you just a little about NAMI. It's the National Alliance on Mental Illness. We have a Greater Houston affiliate that includes Harris, Fort Bend, and Montgomery counties. Our organizations are grassroots volunteer organizations, and we have many members and friends. We have free peer-led support groups and education classes, a warm line with resources and referrals. We'll show that at the end. And our public policy and advocacy group. And several of that group are here tonight. Sarah Hornstein, Brenda LaBar, Neil Sarahan, Leslie Buck, and others I'm sure that I cannot see, but they're out there. We are streaming on Facebook, and also we are on Zoom. The purpose of these dialogues is to give our members and friends in these tough times the vital information that they need to understand your positions on mental health issues so that they can vote for mental health in November. Our moderator tonight is Dr. Neil Sarahan. He is a native Houstonian and the executive director of NAMI Greater Houston. He has a distinguished background and career in education for development and growth for persons with neurological differences. His PhD is in applied developmental psychology, and he was the first executive director of the Monarch Institute for Neurological Differences here in Houston, where he initiated and oversaw many important innovations in this learning community. And we are just thrilled with what he has done as the executive director of NAMI Greater Houston. So I'm turning it over to you, Neil.
All right, Jane. Jane, I'm not running for office. Thank you. Thank you very much. I really appreciate that. And one of the things that's so important to NAMI is to understand and see what our pivotal goals are. And so in the National Strategic Plan for the National Alliance of Mental Illness, we have only 3 priorities. That is, that we want for individuals with any level of mental instability to have early access to care. And the second thing we want is that we want earlier intervention. Right now, in the public policy and in the health policy of the states, the people that get the care are the people that are at the end stages of mental illness, at the most extreme edges. And we don't have a good primary care platform, which bothers us at NAMI because we are an all grassroots organization, right? We are amongst the families and the living family members and the earlier experiencers of depression and anxiety and bipolar disorder and schizophrenia. So our families and ourselves, myself, I know what depression looks like at the level 1 and 2 level of seriousness, and I don't want to go to level 3 and 4. I've been there. I don't want that. So early intervention is our second priority. And the third priority is community-based mental health treatment as an alternative to jail. That right now in each of our counties that the primary care, the dominant care deliverer of mental health treatment are the jails. And we know that that's not the best place for care. So we have tonight with us, we have candidates from districts 15, District 26. That's you, Cynthia. Give a wave. And hey, there you go. I like that. And District 27. These areas cover Montgomery County and the Sugar Land southeast area of Houston at the Texas House of Representatives. I want to tell you that we have invited the entire membership and incumbents and candidates for every House position in the Harris County, Fort Bend County, and Montgomery County districts, because that's the area that NAMI covers. NAMI Greater Houston covers those three areas. So we wanted to have a discussion tonight with all the people, and over the next 4 days, with all the people who have responded as wanting to come or able to come in these busy times to talk to us about our mental health priorities. Each candidate and each candidate was mailed a set of 10 questions, which framed the priorities that we were going to have. Each candidate was invited to appear, and they were also sent the policy platform for the Public Policy Committee for NAMI Greater Houston. So what we wanted to do is start out by format and give each of the candidates a chance to talk for 2 minutes. And we asked that's the frame that we set for how to go forward. And that would be Lorena Perez McGill from District 15, and Cynthia Ginyard, sorry, dear, who is representing Sarah DeMerchant this evening. So with all that said, I thank you very much for being here, and I would invite, and I think what we're going to do is ask our brains behind the scene, Jessica McDaniel, to first put Lorena Perez McGill in full screen on the Zoom program. Is that all right? And we'll give you 2 minutes, and just anxious to hear from you.
Thank you so very much. I think I am full screen now, aren't I?
Mine's not, but.
I'm not seeing that.
Neil,
yes.
Do you want to tell folks about the chat box, or are you going to do that later?
Oh, great. Yeah. I mean, at the bottom
I'm sorry
of your
to interrupt.
No, that's okay. That's okay. We're learning, and we're getting it together here. At the bottom of your screen, there is a chat box, and we have people who are watching that chat box to get your questions to the people, or in general, questions that you want answered about mental health, to be sending to us. So as the evening goes on, I will, somebody will tell me what to do. And there's Lorena on full screen. There you go. Thank you.
Well, thank you so very much for this opportunity to talk with all of you, and to everybody else who's watching. I am Lorena Perez McGill. I am the mom, wife, lawyer, small business person here in South Montgomery County, who also wants to become the representative for all of us in the community, and who wants to bring some common sense into Austin. I am running because I do see that even though Texas is great, we can do better. I am also running because I see how much of a void there is. And one of the aspects in which we see a challenge, it is in access to access to healthcare, including access to mental health care in our community and in general also in the state of Texas. I think that what we have done in the Texas legislature as a state is just baby steps compared to what we could do. You actually did say it correctly in terms that what we have right now is a big system in the prisons, just addressing the issues that should be addressed appropriately by mental health care facilities. And that is something that I look forward to stopping, and that I would like to address whenever I go to Austin. I look forward to the discussion today. I look forward to whatever I may have to learn from you today. And I look forward also to the discussion from everybody who is watching us live. Thanks.
Oh, thank you, thank you. And may I invite Cynthia
Yes.
Ginyard to come on to full screen and tell us, please, I think you are speaking for.
Sarah the Merchant.
There you go. There
Yes,
you go. That's
indeed.
right. I
Yes,
want to
a
hear it
good,
from
good-
you. And what area of town is represented by this district?
I'm Cynthia Ginyard. I'm actually chairwoman of Fort Bend County Democratic Party. And I am sitting in for Sarah the Merchant, candidate for state representative, House District 26. 26 represents Sugarland and a few pockets of Richmond. Sarah is in this race for the third time. We say the third time is the charm. She has always been and still is an advocate for healthcare access. So taking care of mental health is a part of that package. Sarah is a wife and a mother, and like so many of us, if we have not experienced those issues in our families, we get to listen to our friends and acquaintances. And one of the common denominators that you hear is intervention is almost insurmountable. I want to help. I have resources to help. And it's almost as if there is no adequate help. And the help that is available has so many conditions. And as the doctor stated, care is given at the end stages of it. And of course, as a legislator in the State House, Sarah the Merchant would be an advocate for early intervention. We know that early intervention is key in any kind of remediation or treatment. So she is quite open to fighting for the rights and for healthcare for all citizens, and that is including mental health issues. And that's one thing we have to realize, that mental health issues are medical issues, and they have to be treated as such. Thank you.
Neil, you're on mute. Can't hear you. No,
It's very faint, Dr. Neal, so I think it's a volume thing, perhaps. Still very faint.
And how about now?
better.
Better.
All right. Thank you, friends.
You're still low.
Cynthia, I'll be louder.
Okay.
Cynthia has been mentioning two of the prime assets of the of getting access, or one is that mental health isn't often treated with parity in terms of our system's availability or in terms of insurance coverage. And we have to work on that real hard. And we would ask that all candidates take on that issue. Let me see what I wanted to mention the and we feel obligated to mention that Lorena McGill, Perez McGill, her candidate is Steve Toth in Montgomery County. And for Sarah DeMerchant, that candidate is JC Jetton. Yeah, and I think, am I right that that JC Jetton is the incumbent?
No, he is not.
Okay,
It's an open seat.
it's an open seat. All right.
Rick Miller is the
Yeah.
incumbent, but he is not running for a re-election. So statistically, it's an open seat.
Yeah, okay, so that's I think as we're trying to educate ourselves, it's important to know who this is. And we are waiting for Ron Reynolds to step in. But if how about if I jump to the set of questions that we have, that we'd really like our members to have an opinion about, and I'll be ready to just. There's an arm. There's a mom. Yay! I love that. Boy, you are being supported. That's your best supporter, I bet.
The beautiful world of Zoom, right? Your
Yeah,
own
it's
little
so
boxes
wonderful.
and people come in and out.
It's so wonderful. We celebrate it, and I think it's one of the best things that about Zoom. I have a couple of questions, and I'd like for both of you to answer. And if Representative Reynolds comes in, I think these are pertinent to the issues. Now, number one is that Texas has made progress on mental health funding, but it hasn't been enough to catch Texas up to any kind of average of per capita spending on mental health, on public mental health services. In fact, it's at the lower range. In fact, it's last. Now, even though we are on a track for improvements over the years, and that's really true. In the last session, we caught up on about $5.5 billion. But in the face of the economy that we are having, and the legislature is going to have to make choices with less money. And we would like to know if you will be an advocate for defending the increases that are in place, and God willing, promoting that set of bills and budget procedures which are going to get advanced funding forward. So that's the question, and I would give each of you 2 minutes to speak to that funding issue.
Sure. Do you want me to go first?
Or
Sure, sure. Thank you.
Wholeheartedly agree. We were, what is it, 48th or 50th in the country, and I'm not satisfied. Neither should any of you, including those of you watching on Facebook Live. Yes, I do. Well, especially now. I mean, look at where we are right now. And this is from personal experience. At the beginning of the COVID-19 crisis, one of my friends and neighbors took his own life. And this was in April. So far, two of my daughters, my teenage daughter's friends, have been hospitalized, one of them twice. The crisis is affecting us in so many different ways that it's not just the virus, but it is also mental health. And as you very ably said before, and I don't know why it is that I am not the one who's maximized, but you look cute. I really like your outfit, Ms. Guignard. And I'm the one who's not big, at least not on my screen, but in any
I
event.
can see you. You're maximized on my
Oh, I
screen.
am maximized. Okay, that's wonderful. Sorry about that distraction. But we have to find, and my solution is we need to figure out how it is that we are going to make a budget so that we can continue the way that we have been going through now, understanding that we are going to have to be nimble. So yes, and I do have proposals on how it is that we are going to find funding so that the money that we cannot collect from the property taxes because of what everybody's going through with COVID, we can find some other way, and we can discuss that later.
Thank you. Thank you.
I believe that mental health concerns have become increasingly prevalent in our day-to-day lives. Mr. Merchant will be a fierce advocate for ample funding for mental health. One of the things it bleeds right into is criminal justice reform, which is another issue that she is a fierce advocate for. And no, not all the time, but a lot of the times, you can even see from, as a television viewer, that there is something wrong here. What brought this situation on? And naturally, to an outsider, it's criminal behavior, but that is more of the end result than how it got started. Me individually, I am a retired educator, principal, HR director. We so need intervention when they're young. You see it then, and you can almost foresee what is to come when this individual becomes an adult and is no longer under the umbrella of their parents. I believe that even in the House and the Senate, there is a lot of educating to be done. I do not believe all legislators, a lot of legislators even understand. They just think it's a behavior problem.
Yeah. So
You
would
just
you
bad.
be saying then that the policies relative to the budget, because remember, this was a budget question, that you would or Representative DeMerchant would look at the School Safety Act, would look at the expenditures for community treatment, and would look at the supports that are necessary on the presumption that right now, we've been saying that we think you'd excuse my language, but we think you have to be crazy to not be depressed or anxious, right? That's the and so our programs 3 or 4 years ago, when the issue was Santa Fe and safety in the schools, the legislature stepped forward and it funded state school initiatives, which now mandate that there'll be social emotional learning in our schools. And that's an advancement. So I think I'm asking about from both of you about what you're wanting to protect. And I understand the desire to protect, and I'm wondering if either of you have any comments about any way that we could help you in knowing, NAMI could help you in knowing what to protect that's up there that's making a difference.
Well, as I sit in for a prospective legislator, I think it's NAMI's role to make sure the legislators know and are aware of what the dynamics, the intimate details, broaden their knowledge to, so that they can impart that to the committees and the bodies that they're working with. And
Yeah.
I believe it is your role as NAMI to be that resource, because your legislators are working on so many different issues, and it is up to you to make sure they are fighting for the things that are most appropriate, because you know best.
Well, thank you. So what I think what we're trying to line up is, if will you as candidates be our defender? Will you be open to be you know, it's sort of arrogant, but I mean, we do know some of this. So
Absolutely, from the DeMerchant campaign. Absolutely, absolutely.
all right. Thank you. And Lorena?
Ditto from here.
Yeah.
Ditto from here. I want to protect Texans. And when I say Texans, I mean all Texans. Of course. Yes. With me, you're preaching to the choir.
There you go. And so we just want you to sing.
You really don't.
Now, I have another question that I think is really horribly important. And it's again, another money question. And that, you know, it is for the last 6 to 8 years, while Texas has chosen not to expand Medicaid, the state has been receiving billions of dollars in what's called the 1115 waiver.
Mm-hmm.
Now, the 1115 waiver in Fort Bend paid for the entirety of building the CIT program. It built the entirety of a continuum of care in the criminal justice system in Fort Bend. I'm not aware of the many ways in which the 1115 waiver has paid for Montgomery County services, but maybe Brenda can help us out here. Now, the issue is that these funds are being phased out. They are decreasing by percentages, and they are about ready to go away in the next year or two. That will leave horrible gaps, dangerous gaps in Texas health systems, because that's where 1115 waivers went, right? And so my question is, would you be willing to support the governor to accept federal funding to open up Medicaid eligibility for low-wage adults? And as I understand it, that is first and foremost in the governor's hands, but the legislature can have a powerful impact on confronting this. On top of everything else, we are set to lose billions of dollars more by not accessing Medicaid expansion. And so I'm wondering if we could have a discussion about that support.
Well, I'd just like to say that as politicos and political activists, we have just been feeling tormented by the fact that our state is denying, excuse me, is denying healthcare accessibility to so many of our citizens who need it. I guess we'll just have to wait maybe until we get a Democratic governor before we have Medicaid expansion here to help those who do not have health care. So Sarah DeMerchant is on the record in 150% support of Medicaid expansion. We feel like, why don't we have it already? How could we not? We have so many who could benefit from it. At times we have to step back because so many of us, maybe on this Zoom, healthcare has been something that's always been available to us. Therefore, we don't know what it's like not to have it. And that's a wrong that needs to be corrected. Sarah will be on the front line fighting, just know that. And I know Lorena will be as well.
I'll be alongside Sarah. And
Yeah.
here's my comment to that. I really think that if we put the topic on the ballot, we may expand Medicaid, because I think that this may be when the time is ripe for us to just put it on the ballot as a matter to see if what the people want. And here's why. If you look at some of the other states where there had not been Medicaid expansion lately, they have actually voted for Medicaid expansion. Look at what happened in Nebraska, in Oklahoma, in Missouri. It may be that if we make the push to put it on the ballot, we may have the people, we may have all Texans decide whether or not we should go for Medicaid expansion. And Neil, the one thing that I wanted to clarify, one thing is to say that we're losing all of that money. You know what really pains me most? That's money that we already paid. That's our federal tax dollars that we are paying, and then we're not taking back for those so sorely needed services. And that is why we are at the bottom of the list when it comes to healthcare, and including mental health, access to healthcare and access to mental health care.
It is difficult for me as an individual to understand even why you would deny your constituency better health care, more liberal access. It's just really difficult for me to understand that. A leader takes care of her people, his people. in any situation. That's why you're the leader. So it doesn't always meet your needs. You may not even have that need, but as a leader, you're thinking about others and their needs. So I just struggle with that as a citizen. I really do. I struggle with that. I really, really do. So please don't fear with the merchant on the front line for Medicaid expansion. It's a part of our disgust, a part of why we have both stepped up over the years and have been involved. I never wanted to be in politics. I hate politics. But in 2016, I ran so I could help make it better. And not unlike Mr. Merchant, that's the way we feel. We have something to offer and we want to make it better. I try to make it better for the county. She plans to make it better in the Austin venue.
In the House.
Yes.
Well, thank you. I have one more question. And then I'm going to open it up to a little more dialogue. And my question, we've been talking about access and early intervention through these funding mechanisms, right? It relates to the first question on just simply per capita expenditures and defense of the ways in which Texans get access right now. And the second question was about that there is available money and that Ms. Perez McGill was saying, and she's correct, that other states who have held out for Medicaid expansion for quite a while are now facing the fact of the collapse or of their healthcare and mental health care systems, losing the progress that they've made. And you can almost hear the teeth chattering about, no, we don't want this. And so my next question is about what's going on right now in criminal justice, in the intersection of criminal justice and mental illness. And so that's that third priority that NAMI has as a national movement to decrease imprisonment as a treatment zone for mental illness. You might know, and I bet you do, that the third largest mental health treatment hospital in the nation is here in Harris County, and it is the Harris County Jail.
Mm-hmm.
In Montgomery County, the numbers of people who are receiving mental health care in the jail system is, as I believe it, is above 60%.
Yeah, I believe that.
In Fort Bend, the largest treatment zone they have one mental health hospital in Fort Bend, and it is outnumbered by more than 150 by the number of people who are receiving mental health care in the Fort Bend County Jail.
Mm-hmm.
Now, so my question is, will, as candidates, will you support continuing expansion and funding for mental health court systems and community treatment centers?
Mr. Merchant will support that and beyond, because we both believe that what we're speaking of right now is the now problem.
Yes.
But we have got to get these babies when they're in their formative years. which means getting public education more involved, more in tune, more intervention, because, oh, you can recognize it in kindergarten. Oh, you can see it. You know, once you see enough children, when it's different, you know it, you know it. So we need to start there in order to neutralize the situation when they get old enough to get in trouble, if you will, okay? When they become early teenagers and old teenagers, because the behaviors that they exhibit are seen not as a result of the mental illness, but is just seen as, oh, that's just a hardcore criminal wanting to do the wrong thing. And then you've got the family issue of denial when it is mental health issues, and they do not always want to take the appropriate route. So it is an issue that has to be looked at holistically. In as
Well,
much
can I interrupt on
yes,
focus on the fact that right now, Fort Bend County is in the infancy of stages for what are called diversion programs. And Harris County is ahead, and that there are state funds that are available, and this idea of that we have to in the now be diverting people from the chronic. I have a friend who's homeless in Florida, and he has the reputation of being the most arrested person in Orlando, Florida. He's been arrested 45 times in the last 3 years, and he is my friend. And the absence of treatment, the absence of diversion in community centers is what keeps Chris in rotation. He's known and respected. He's known, he's famous, he's infamous, right? And this is the situation in Fort Bend County, and I think it may well represent the infancy of mental health courts in Montgomery County as well. And it is the pressing issue. And we can't wait for the schools to be growing up different family awarenesses, because those people are waiting in jail right now. And I just want to focus the issue on, for the candidates, on extension of these mental health court treatment centers. They just need they need funding, and they need commitment to set them up. So can you please carry that message to Mr. Merchant? There are state funds available for this, and we need to get better. I know the probate judges in Fort Bend. They do a really good job, and there's one person who has all the mental health cases. And then if you think about the mental health cases in Fort Bend, that's about 60%. So how can one person deal with the flood? Lorena, can you help me on this issue of supporting expansion and funding of mental health courts and community treatment centers?
Most definitely. And here in Montgomery County, the case is that one of the precinct's constables is the one who is in charge of mental health services. So we've got constable from precinct 1, Philip Cash. It's under his purview that we have the scarce mental health services that we have for the whole county. And I will tell you that it was really sad to see him go before Commissioner's Court when they were discussing the budget, and just knowing that, you know, it's whatever they have is pretty scarce, and that there wasn't that much more available at the time being. But that's what we have right now. Yes, I do believe that diversion programs are key. What's key also is trying to stop the school to prison pipeline. It is just trying to stop that structure that struck me the first time I heard it about, you know, the state counting how many beds they're going to need in prisons by how many kids drop out of school, or how they're doing in fourth grade, which is unbelievable. So I do agree with that. And what's interesting to me is that both Republicans and Democrats do agree in criminal justice reform. And even though they agree on it for different reasons, because at least some of my friends who happen to be Republicans tell me that it is all about the money. I, as a Democrat, understand that it is all about people doing better and not having to end up being in that kind of situation and being in jail, so that they can receive proper treatment and the proper medication to deal with whatever mental illness they may have, or even to be diagnosed for it. So you can count on me. I've been with you advocating. I've seen it, because I'm also a volunteer with one of the programs with my church, where we go to the juvenile detention center in Harris County, where we go to the women's juvenile detention center. And I see it firsthand. I see that some of those young ladies need proper healthcare treatment, and they go to the juvenile detention center to get diagnosed and to get treated.
And then there's one thing that I'm finding out, and I speak for myself here, but all of our Lorena, Sarah, they can't get these things done alone. And you talked about Commissioner's Court, the district attorney, the county judges. It takes many of these elected officials in order for your counties to get some of the things that they need along this line. And the more elected officials we have who think like us, the more apt we are. You mentioned the judges, you mentioned constables. And I didn't realize it until I got Democrats in office, okay, how that all works together. And even that includes city government sometimes. So the more elected officials we have who think from our paradigm, then the better off we're going to be able to help in the area of mental health, and not only mental health, but other issues too. But mental health is certainly one of them. I recall, what was it? I think President Reagan was in office when they closed all the facilities, and we've just kind of gone down.
Yeah, we saw a radical collapse of community mental health public in that administration. Say, we've had a really good discussion. I'm sorry that Representative Reynolds has not shown up yet. We have just about 8 minutes left in our discussion, and I wanted to give you all a chance. If there were questions that I didn't ask, or if there were things that you wanted to say, I wanted to give each of you about 2 minutes to say what you want from us, what help you might want, and how you might summarize your positions on mental health. I really would appreciate that. So in either order.
Yeah. Do you want me to
So
start? I can start.
Well,
sure, thank you.
go ahead.
Well, number one, thank you. Thank you for what you guys are doing for the organization to continue to push and to do so. I mean, you guys are all doing this on a voluntary basis. And because of organizations like NAMI, we can now talk about mental health, mental illness without having it as a taboo issue, which to me is wonderful. When people have, heart problems or suffer from diabetes, they don't have any problems expressing it. I don't see why we would have any problem expressing that we have a mental illness, or that we need assistance. Continue to do that. I've been with you advocating. So I've been on the side of going to my legislators and advocating for legislation that addresses all of the issues that impact the community. I look forward to being on the end of being the legislator that's being advocated to. You have an ally in me, and I know that this time more than ever, we are going to be needing to be strong, and we're starting from a really weak point because, as all of you know, I'm preaching to the choir here. We are in a very bad position in terms of access to healthcare and to mental health care, but we'll do it. You know why? Because Texas is great. So we'll get it done. Thank you so very much.
Thank you. Thank you.
Yes, we will. Thank you, Lorena. And yes, you and Sarah will be out there fighting all the way for all the things that we believe are good for our citizens.
I believe in fixing. I don't believe in fighting. Fighting gets us nowhere.
There you go. There you go. There you go. And even as we experience this pandemic, it's taking a toll on some. So we're living in a new time right now, wherein we don't know all of the outcomes because we have not been here, done this. So it is even more important that NAMI stays on the forefront, supporting your legislators, providing them the information, research, insight that they would need to help their colleagues understand why they need to support improved finances for mental health. It should not be looked at differently from physical medical conditions. It is a medical condition, but that's where I say that education is so important, because so many of them do not understand that. How it bleeds into criminal justice reform. I believe there's a lot to be taught there. I think that there are many of them who do not understand that. It's not in their world, and they can't see that periphery there.
Yeah.
Well,
there seem to be two systems for the trajectory of mental health care, and those it's highly disproportionate that people without access, without means, are typically getting their mental health services in the prisons, and their behaviors and discords are being interpreted as criminal rather than that funding system. Well, I thank you so much, both of you. I wanted to highlight that tomorrow night, we are going to be hearing from state senators from District 4, 11, and 13. And I was an idiot, and I wrote on this black piece of paper with the names of the people that are going to be with us tomorrow night, and now I can't even read it. So that's how it goes here in moderator land. But Jane Malin will be our moderator, and we're looking forward to joining that discussion. And then next Wednesday and Thursday, we'll be talking to more district candidates, and we'll be talking to the 2 candidates who are running for district attorney in Harris County. And I thank you so, so much for joining us tonight. I wanted to make a special mention of the support that WellPath has given us in time and talent to put these features together. And we're grateful for that. We're grateful for the candidates that were able to be with us tonight. And if you have, does anybody on the Zoom line have any comments that they wanted to say? We do have recordings of the chat line on both Facebook and on the Zoom lines, and so we will happily provide those to Lorena and Cynthia, so that if you have other questions,
yes.
we still have some minutes to put them on and direct them to you.
That is wonderful.
I was wondering about Markeisha. Did you have anything you wanted to add in here? Or?
Yeah. Actually, somebody made a very good comment, and voting for mental health is not a partisan issue, because mental health does not know of political parties. And the last one thing is vote, 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 vote. Please,
Yeah.
people.
Great.
All right. So Neil,
Yes.
I finish do the ending part here, or do you want some more time?
No, I'm done.
Okay.
I'm toast. I can't even read my notes anymore.
Okay. I did want to, first of all, say that the candidates tomorrow are Jay Stittelberg from District 14, Larry Taylor and Judge Susan Chris for District 11. That's in my area. That's why I'm happy to be the moderator tomorrow night. And Belinda Morris from District 13. So that's tomorrow night. And I wanted to say again, thank you so much, Lorena and Cynthia. We really, really appreciate your enlightening our Facebook and on Zoom. It's really great. I also thank our participants on Facebook and on Zoom, because you're here to help inform yourself, so you'll vote for mental health.
Thank you for having us.
Thank WellPath for their support. Did you do that yet, Neil?
Yes.
Brenda works for them, and they've been very supportive of getting these things going, and it's really wonderful. So sign in for the next 3 forums. One is tomorrow night, and then there are 2 next week. It's wonderful to be able to hear from our candidates. I really appreciate it. Thank you.
All right, thank you.
Thank you.
And I think we had some posters that we were going to put up at the end here.
Oh yeah, just the poster for the forums.
Well,
Oh yeah, we have a poster, Jessica, for the warm line. You gotta put that up.
Yeah. So first and foremost, we're here to help make a difference, and you guys do that legislatively in the political arena. We've recently expanded our warm line services for referrals and a helping hand. This is the poster that we'd appreciate your help in passing out from at
Definitely.
713-970-4483. There are people living in recovery who are waiting to get your calls, and they're also initiating calls to our whole care network to the tune of about 1,000 calls a week. This is unprecedented. This is more than the Harris Center is doing on its COVID support line. So if you wanted to we'll send you the text, and we'll send you a copy of this as you wish. We have all your emails.
Can you scroll, Jessica? Scroll it.
There you go.
Yeah.
So those are some behaviors. On the bottom are some resources, and then on the back page is the various degrees of instability, and all the way to suicide, unfortunately, and psychosis. So there's a playbook there for how people can respond if they feel emerging unwellness, being unwell. How do you get help and in crisis? And our warm line counselors are ready to steer you toward just a huge, extensive list of resources in all sorts of categories. So we thank you for that. And with that, I think we probably maxed out our Zoom bill for tonight. So, and here it is on the Aditi Chosky is on the chat line with the information that would get you those forms.
Beautiful. Thank you so much.
Thank you.
Got it.
Bye-bye.
Bye-bye.
Good night, all.
Good night.
Thank you, Jessica, for connecting us up.